Hi, Patty Brennan. Thank you so much for sitting down with us at TED Med. Can you please tell us about Project HealthDesign and tell us who you are?
Sure. Hi, I'm Patty Brennan. I'm the National Program Director of Project HealthDesign. Project HealthDesign began from the visions of people who wondered how technology could best assure patient-centered care. So building on the conceptual and organizational philosophies of the 90s that said care should be focused on the patient, different individuals began to look to see what kind of information tools were needed to make that happen. Initially, personal health records were viewed as a way for a person to compile all of their data from all of their clinical practice care events from every point in their health history. But it became clear early on that a bucket of data was not useful. Getting data that would support action may be much more valuable to the individual. So with the guidance of Steve Downs and the advice of people like Mark Pearson and Amit Mogadam, we began to think about how we would re-envision personal health records, moving away from the idea that they were simply the basis of a repository for health information and started to think of them more as a platform for action. Now that required us doing three things. First of all, it required us to think about patient-centered care, user-centered behavior, so the record needed to be useful for the individuals, the people who were going to make use of them. Secondly, we had to think about different aspects of data and action, information that could support action, and that required us to really redesign the approach to building clinical records from thinking of them as solely a data bank to thinking of them as a data platform on top of which a series of different applications could run. The third challenge we faced was bringing data together from disparate parts of a person's life, from the dentist, from the eye doctor, from the family practice doctor, from the cardiologist, all into one platform. Bringing together integrated data, separating data from the operations that were used to make sense of the data, and doing it in a way that made sense to the user are the three hallmarks of Project HealthDesign's early contribution.
Can you tell us about observations of daily living? What are they?
So in the course of the first round of Project HealthDesign, we found that while individuals thought about their clinical care events and the records of those events, they really lived health in everyday lives, and they really were looking for tools that would help them better understand health patterns and activities, indicators for health, if you will. So we think of observations of daily living as those cues that people use to tell themselves how they're doing to help explain health problems to them, and maybe to give them an impetus to action. An observation in daily living could be a sensation in a person, the tightness in your neck, or how well you've slept. It could be a behavior, how often you walked or remembered to take your medication, or it could be something external to the person, something in the environment, like the pollen count or the amount of fighting that goes on with your children. Looking at how these indicators, these observations are influencing an individual's sense of themselves as a healthy person, this really came through very strongly when patients told us, don't give us tools that just tell us what happened at the doctor's, give us tools that help us tell the doctor what happened in our lives.
Can you tell us anything about how the observations of daily living are being collected or applied?
So that's one of the challenges of observations in daily living. How do you collect them in a way that's easy to get access to, not burdensome to the patient, and can be converted into some kind of a meaningful display or interpretation? Our current teams in the round 2 of Project HealthDesign are experimenting with a number of different approaches. For example, we have a team in San Francisco that's working with teens who are at risk for depression and who are also obese. That team is using cell phones to both send messages to the teens and capture information in the spot. How are the teens feeling? Where are they? Are they with friends? Are they alone? And the team is using the capacity of cell phones to take pictures, to be geo-aware so that the teens know that they're entering a place where there might be too much of a temptation to eat, or there may be no friends around, and the phones can help integrate, send off a signal and alert them they're coming into a place of risk. They may want to call someone or be with someone else.